Hi, Christian Manietta here from Trigger Point Performance Therapy Australia. Today I'm going to talk about lower limb injuries such as calf strains, plantar fasciitis, Achilles problems, basically any sort of foot or heel pain. So you have some sort of lower limb injury. What you need to understand is that it's going to take a multifaceted approach and responsibility on your part to totally get rid of this injury. These things I'm going to discuss below need to be done concurrently. Remember, for every effect there is a cause. Well, actually there's lots of little causes that are going to create the effect. So let's get into what you need to do. First up, you probably don't realise that your lower calf muscle, your soleus, is extremely influential on your body's biomechanics. Once this loses its functionality, it's going to be one of the main culprits creating your injury. So if your therapist is not treating your soleus, then I'm sorry, they're just giving you a band-aid approach and your injury is never going to be completely fixed. Now, all of your muscles are independent of each other, but they have to play ball together. So when a muscle tissue is bound up, not doing its job, it's going to make the others work harder, which is going to eventually create the problems that you have. It is amazingly difficult to isolate each and every muscle, so when we're using self-myofascial release to treat the calf, we want to treat all of it, and that way we get the greatest rate of return. So in terms of treatment, we want to treat our soleus, we want to treat our posterior tibialis, which is on the inside of the calf. We want to treat our flexors, which are on the outside of the calf. We want to treat the gastroc, which is the big part of the calf up the top. And we also want to treat our peroneals, which run down the side of our calf. And we want to treat our tibialis anterior, which is the shin muscle on the front. No matter where your lower limb pain is, if you treat all those areas, you're going to get it fixed. Okay, that covers the lower limb and the muscles that we need to treat, but it's not just about treating the tissue. That's only part of the puzzle. Posture in and out of training makes up a huge part of this. Think about plantar flexion. This is when your feet are pointing. If we're in this constant state of contraction, i.e. like your calf is shortened, over time your calf tissue is going to bind up, and this coupled with some little habits and some nutritional things is going to put you in an optimal environment for injury. Now there's no doubting that when we train, we're generally in that heel raised forefoot position. So, and even swimming, that's going to affect this pointed foot, and these repetitive motions over time are going to overwork the muscles in the lower leg and create problems. Now this is okay when we know it, and we also know that we have to look after the tissue. Now I mentioned how we sit in the ITB video. It's very important that we don't have our feet tucked under us and our heels raised up, so you've got to keep them flat. But even how we sleep, toes pointed, and even the shoes with heels, okay, so high heels. But what about our training shoes that have been built up the heel, you know, those fan-dangled, motion-controlled, cushioned trainers? I'm not a fan, but these will compound your problems by continually shorting your calf tissue. These little idiosyncrasies, non-treated, will bind up your tissue, and it's going to decrease your mobility in your calf. And when you stretch with that muscular dysfunction, you'll increase inflammation and make your injury worse. Now talking about inflammation, low-level chronic inflammation will cause chronic pain and keep you injured. The inflammation is caused by gross dehydration and also our Western diet. Now I'm going to talk about inflammation more in the blog below because I can't do enough on talking here. So make sure you read the blog below, leave your comments, and together we can help live a long-term healthy life. Thanks for checking in.